If it's okay, Paul, I would like to ask you a few questions in your medical history.
Oh, of course.
Okay. Have you ever had any liver or kidney problems?
Not that I know of, no.
Okay. What about any mental health conditions?
Well, Dr. Jordan, I was diagnosed with depression many, many years ago, and I was on Prozac for about a year, but I haven't had to go back on the medicine since.
Yeah, I remember you telling me about that. I'm glad that you're not dealing with the depression anymore.
Yeah, that's really great.
Yeah. What about any sleep problems, like disruptions in your sleep, or has anybody complained about you snoring?
I mean, I don't sleep much. As I mentioned earlier, I'm lucky if I get 2 hours of sleep at night. And what little sleep I get, my wife's never mentioned that I snore.
Okay. Paul, now it's really important for me to ask you some personal but really important questions that I ask of everyone. All right. Have you ever had problems with drugs or alcohol in the past, or are you dealing with any problems now?
I don't have any problems now, and I'm not sure I would describe it as a problem, but when I was in college, on the weekends, everybody partied, and we drank a lot of alcohol, and I remember, probably passing out maybe 2 or 3 times.
Okay. What about now, Paul? Do you drink any alcohol now?
Yeah, I have, beer every now and then.
Okay. So, how much would you say in a week or a month are you drinking beer?
Probably not even a week. I probably a couple times a month I might have 2 or 3 beers. If we go out to dinner or if we have to go to a function like a wedding or something like that.
Okay, so it's not a problem for you.
I don't think so. No.
Okay. And what about drugs? Have you had any problems with drugs in the past, or do you use any drugs now?
I don't use drugs now. Again, I don't think I had a problem when I was in college. I experimented with weed, maybe 2 or 3 times. I really didn't, care for it that much, so I stopped doing it.
Gotcha. Okay, Paul, thanks for being open and honest with me about those things.
You're welcome.